Hey everyone, my name is Dr. Justin Sloane and I'm a board-certified obstetrician and gynecologist who works out of Pennsylvania. I'm a TikTok influencer with more than 100,000 followers, and today I'm going to be trying YouTube, so bear with me and stay tuned to learn more about uterine fibroids. So before you can understand fibroids, the first thing is you need to understand the anatomy of the uterus. So the uterus has two layers. An internal layer, which is, I like to use the metaphor of an orange. You have an internal layer like the juicy part of an orange, and that's the part that grows every month and then bleeds with your period. Then you have an outer layer like the rind of an orange, and that's a more firm layer, that's a muscular layer in the uterus, and that's responsible for contractions and cramping because it can squeeze the outside and push the inside out. Think about passing a clot, pushing out a baby, or juicing an orange. Now, a fibroid is an overgrowth of that outer layer. So if we take the uterus and slice it in half, you can see it here with the bladder above it, the bowel below it. Here's the vagina, and right here is your uterus, and it's got this inner pink layer that bleeds every month, and then this kind of darker pink area, that's the muscle. The fibroid is a growth on that location. Now, a fibroid, because it's on the rind, on the outside, can grow in one of two directions. It can either grow into the juicy layer, in which case it squeezes everything together and makes you juice more, makes you bleed more, or it can go outside of the juicy layer, in which case it adds to the outside of the orange. It makes it a little bit uneven and can add weight and bloating and pain and compress on things that surround the outside, like your bladder or your bowel. So here we see a photo of the fibroid grading system. And what you can see is that fibroids can grow onto the inside of the orange like a 0 or a 1, in which case they're pushing on that juicy layer, pushing on that purple layer, and that's going to cause you to bleed more heavily. These types of fibroids tend to be able to be removed from the vagina, however, because you can go through that natural orifice. Alternatively, you can have fibroids that grow on the outside of the orange, on the outside of the rind. These are going to cause different symptoms than the bleeding that a 0 or a 1 is going to cause. These are going to cause symptoms of feeling bloated, feeling heavy, maybe having a mass in your belly, and because they're on the outsides, they can't be accessed through the vagina or the cervix. They have to be accessed via surgery through the belly button. Now, treatments will vary depending on how big your fibroids are and the location of these fibroids. So the treatments for fibroids vary depending on the location. If you have a fibroid growing onto the inside of the uterus, then you can access it through the natural orifice that's already there. It's like delivering a baby. You just go backwards into the uterine cavity, and you can either shave off that fibroid or try a hormonal therapy to stabilize. Every month that lining grows and then it falls out, but the fibroid adds a little extra, so we can stabilize that with hormones like birth control. On the other hand, if the mass is on the outside of the uterus, the only way to access that is to go through the belly button. So there's two types of procedures for that. There's something called a myomectomy, where we remove the fibroid, or a hysterectomy, where we remove the uterus. Now, myomectomy, shockingly, is technically more difficult because sometimes you have to actually shell out the fibroid and do some reconstructive surgery on the uterus. It's also a very bloody procedure, whereas with a hysterectomy, you're not really touching the uterus. You're just kind of detaching the uterus from the inside of the body. And so oftentimes removing the fibroid is a bloodier, longer, more complicated procedure than removing the uterus. Because of this, I usually recommend that people have a hysterectomy first, but if they're not done having children, that's when you get the myomectomy. We know fibroids are going to grow back. We know that once you have one, you'll probably have more. So this just buys you time removing a fibroid to then have a baby, but usually hysterectomy is a more definitive procedure in the long run. So I hope you found this long format video helpful on everything you need to know about fibroids. If people find this interesting and helpful, then I'll start to do more of these, but don't forget to come to my TikTok and subscribe, like, and share.